Here we go.
Hi all, I'm Corinne Hale. My pronouns are she, her, and I work for Columbia Pacific Coordinated Care Organization, and I represent the system of care for Tillamook, Clatsop, and Columbia County.
Hi, my name is Amanda Ray. My pronouns are she, her, and I am a behavioral health system specialist with YCCO, and I support the Yamhill County System of Care Group.
And then Jennifer and Chris.
Hi, I'm Jennifer Schwartz, and I'm the System of Care Coordinator in Lynn, Benton, and Lincoln counties. And I work with Intercommunity Health Network.
And I'm Chris Barnes. I'm the Children's System Program Administrator for GOBI and EOCCO. I cover 12 counties in Eastern Oregon for systems of care.
And then Tracy and Anna.
Hi, I'm Tracy Howard. I use she, her pronouns. I'm System of Care and Behavioral Health Specialist at Jackson Care Connect in Jackson County. System of Care Coordinator. Thanks.
And then Selby and Joylene.
Anna Williams, she, her pronouns, Executive Director, System of Care Advisory Council.
And then Selby and Joylene. Selby, I'm still having your audio problem. Sorry.
Yeah. How about I go next? We'll let you try again after me if your audio's back up, and if not, you could put it in the chat. Does that sound good, Selby? Hi, everybody. My name is Joylene Carter. I use she, her pronouns. I work for the System of Care Advisory Council alongside Anna and Christy. Good to meet you all.
All right. And then Steph and Lucy.
Good morning, everyone. My name is Steph Jerem. I use she, her pronouns. I work for the Oregon Health Authority, and I am the director of the Office of Health Policy, and I'm also currently the policy director for the 1115 waiver, which we're going to get to talk about today.
Awesome. Thanks, Steph.
Mm-hmm.
All right.
Hi, everyone. Lucy Zamarelli. I am the SOC supervisor in Lane County, and our coordinator, Haley Van Horn, is out on maternity leave for another month. So I've been covering for her, and I work for Lane County Health and Human Services. We all do. We are contracted with both Trillium and Pacific Source in our county, Lane County, as our CCOs.
Great. And then Amelia and Danny.
Hi, everybody. My name is Amelia Kircher. I'm the Executive Director for the Amani Center. We're the Child Abuse Assessment Center for Columbia County. And I am here because we have a collaborative project with the CAC in Columbia, Clatsop, and Tillamook for the North Coast for our CACs to support the system of care and hopefully get families connected. But
Great.
Yeah, here.
Amelia, just so everyone is familiar, can you please describe what CAC stands for?
Sure. Yeah, I always forget that in this setting, CACs for you guys are community advisory councils, and we are not that. We are the Child Abuse Assessment Center. So technically the national acronym CAC is Child Advocacy Center, but most people don't know what that means either. But we provide forensic assessments, medical exams, and support services for child victims of abuse. And we also provide like family support navigation services for families that are dealing with like multiple investigative systems and basically connect everybody to the system of care. I mean, we've been doing that for as long as we've existed, you know, getting kids access to resources that they need and therapy and all that good stuff. So I was really excited to get involved with our system of care group. And I think I'm kind of the odd man out in this meeting, but but I'm here, I'm into it.
Yeah, thanks so much, Amelia. Yeah, just so everybody's like, what is Amelia doing here? CPCCO, so I'm sorry, North Coast System of Care, kind of, what's the right word here? Nominated?
Yeah, I can chime in too,
Okay,
because that's
that'd
helpful.
be great. Corinne, sorry.
Yeah, I work with Amelia very closely through our system of care. And one thing that I mean, this is like, we tried this out because to be like perfectly transparent, and Amelia, I know you know this, our contract department can be like really tough to get money through the door. So I worked with Amelia to apply directly for the grant from OHA. So that way she could get access to it without having to go through Care Oregon, just so we could get things moving a little bit faster.
Mm-hmm. Yes, it's great. We're also super excited about it. All right. I think we're at Danny and then Kara.
Morning, everybody. Danny McAllister. I am with Pacific Source CCO. I am the System of Care Coordinator for Central Oregon, so that's Crook, Deschutes, and Jefferson counties.
Hi everyone, I'm Kira Hood. I'm with Advanced Health CCO, and I'm the Director of Behavioral Health, and Pamela, who you probably are very familiar with seeing on these meetings, is on a leave of absence until September, so mid-September. I'm filling in for her, so this is my first meeting and I appreciate being here. Thank you.
Great. Okay, people have moved around a little bit. So I think Katina and Roxanne haven't yet introduced yourselves.
I am Katina, and I'm with the Coquille Indian Tribe, and I'm the Family Support Coordinator here, assisting families that are experiencing domestic violence, sexual assault, and I'm also connected with partnering with the CCO here in Vancouver if people need some support through that system. So thank you.
Great. Thank you so much for being here, Katina.
And hi, everybody. I'm Roxanne Robinson. I use she, her pronouns. I'm the Behavioral Health System of Care Coordinator for All Care, and I work in Josephine, Jackson, and Curry counties in Southern Oregon. And I apologize for my camera not working. It died on me yesterday, and I forgot to put in an IT ticket. So hopefully I'll be back next week.
All right. Tracy, did you introduce yourself yet?
Yes, I did.
Okay, I'm sorry.
Thank you. No, that's okay.
All right, so then we got Savannah and then phone number 503, but I'm going to assume that is Selby. All right, Savannah.
Hi, I'm Savannah. Kate, sorry, I just renamed myself. It showed up as Columbia Health. But I'm a coordinator in Clatsop, Columbia, and Tillamook, working with Corinne, and I'm based out of Columbia Health Services in St. Helens.
Great. All right, did I miss anybody? Okay. All right, well, let's get into it because I am super excited about this conversation. I have some slides I'm going to pull up here. Let's go like this. Okay, all right. So a little bit about the agile funding. So for the past two funding cycles, so starting in the 21 to 23 funding cycle, the system of care kind of identified that you could use these funds for agile funding. What is agile funding? It's really intended to meet the emergent social needs of children, youth, and families. So flexible funding, very similar to CCO flex funds, but with some important differences. One is that these funds are very flexible, and because they come from state general fund, they do not have to meet some of the more rigid Medicaid requirements that are applied to the CCO flex funds. Agile funding is not intended to replace or supplant other funds that are available, but it can be used when those funds are inadequate or administratively burdensome, which we know is definitely a challenge in accessing some of those other resources. So I think, I know not all of you are using Agile funding with your grant, but I think this conversation will be important because we're not going to talk just about the Agile funding, but we're also going to be talking a little bit about some of the other funding streams like flex funds and family preservation funds and wraparound flex funds, and also the new Medicaid health related social need funding. And so just overall, right, how are we leveraging some of the resources in community to meet the social needs of youth and families in the system of care? So in terms of, what is this funding going to? So, in the 21 to 23 grants, those of you who are using funding for Agile services, we asked you to report all of that data. And here's a summary. Here's how we use that data. Because we were really curious, right? We had never done that before. We are really curious to know where's all that funding going. And so this is a high level summary of where that money was spent across the state. Probably no surprise, the majority of that funding, over 50% of it, went to housing in the form of rent utility assistance. So 301 families were served. Transportation and food also served a lot of families. Transportation going to things like gas vouchers, public transportation, car repair, which can be expensive but very important for families. Food vouchers, given the ongoing food insecurities across our state. 61 families received therapeutic tools. So I think these were things like weighted blankets. I'm sure if you've got other examples to share, that would be wonderful to hear. Over nearly 100 families received money to support positive skill development. And this was going to things like amusement park passes, hotel stays, family getaways, extracurricular activities for young people. So that was great to see. 27 to non-covered medical services. Only 13, I was a little surprised by this, only 13 families or youth received funding for sexual orientation or gender identity support. So these were things like gender affirming clothes and haircuts, hair treatments. 33 families received assistance for climate related services, so air conditioners, air filters. And then 224 fell into the other category, which was a lot of different items, things like childcare. I think there was some respite that was paid for here, past due bills, school supplies, storage units, clothing, etc. So just over $500,000 in total out of the total 21 to 23 grants. And I think, reflecting on this, right, in terms of where the money went, probably not a lot of surprise. And I think we need to recognize that the majority of those funds went to things related to poverty, right, to housing, to transportation, to food. So it'd be great today to kind of hear some conversation about that, right? Is given the system of care goals and the families that we are aiming to serve, is this the right use of those funds, given in particular some of the other funding sources that are available to provide things like housing and transportation and food? So, versus things like positive skill development, SOG support, some of those other things that maybe aren't as readily available. I also wanted to bring in some of the stories. A lot of you shared really moving stories in your reports. And so these are just a few that were shared and kind of, I think, describe the range of services that were purchased with these funds. So Agile funding provided a 2-week hotel extension for a grandmother who was houseless and the legal guardian of her 2 young grandchildren. Another shared, I've been working with a mother of 4, one with special needs, to improve school attendance. The school reached out because her car's brakes were failing, creating a transportation barrier to get her kids to school. We worked with the mom and a repair shop to get her vehicle back on the road and her kids back to school. Another shared, the student was able to go on a family trip with dad and a stepmom. This empowered the student and allowed him to have a good time without being afraid of an accident. And finally, one youth in our system wanted to be a professional dancer her whole life. Shortly after starting high school, mental health challenges led to multiple hospitalizations and suicide attempts. As a result, the youth lost all interest in dancing. After finding an effective treatment, she started to express an interest in dancing again. She found a summer intensive dance program that is geared towards youth who may want to pursue dance as a career. Through use of Agile funding, a partial scholarship, and a GoFundMe campaign started by the family, her tuition was covered. Pretty awesome. And I'm sure you have many more that you could share from your work. So in terms of the current grant cycle, so the 23 to 25 grants, 8 out of our 15 regions are allocating grants to Agile funding. I have not seen any of our tribal grants use dollars for these services. So just looking at the CCO regions, that covers 27 out of 36 counties, and you can see the grantees that are listed here. In total, this is 22% of the system of care grant fund. So we're putting out $3 million to the 9 federally recognized tribes, and we're putting out $5 million total to each of the system of care regions. You know, so about a fifth of that grant funding is going to these funds. Okay, before we move on, I'm just gonna pause here and see if anybody has anything to, you know, any reflections or things they want to share out about either your past grant or your current grant in terms of how your Agile funding. Or if people have any questions.
I don't have a question, but I'm blowing up the chat and I just need to say it out loud.
Oh.
Basically that transportation always comes up as a barrier in our system of care. And I think this is just a really good opportunity for us to acknowledge that it is a system of care barrier, because I think sometimes we get into this place of like, is this in scope of system of care? Like what system do we really hold accountable for this barrier? And that can feel like really overwhelming. I mean, transportation is huge. Like, how do you break that barrier? But clearly, based off of like what people are, the most people were accessing transportation through the Agile funding. So I just think it's really important that we talk about that in all of our system of care spaces, including like the state system of care advisory council. Like transportation is clearly a system of care issue. So how can we better collaborate to solve that one through a system of care space?
Yeah, great point, Corinne. And I think the story that I pulled out related to transportation is just like so on point with why that's so important. Yeah, see lots of agreements and nods around the transportation funds. Yes, hi, Chris.
I'm just going to wholeheartedly agree with Corinne. And then I was going to share that, like when you talk about the food, where there was lots for our community, when we gave help for food, it was for people who already receive food stamps, or they made $10 too much to receive food stamps. So like, also that's a piece that I think needs to be taken higher, as far as like, I don't know that food stamps is meeting the needs of the people in our communities, when most of our communities you can't go to Walmart or Winco or somewhere that maybe it's cheaper to buy food. So.
Right. I mean, food is so expensive, and then particularly out in Eastern Oregon, right? I mean,
Yep. I just don't know that those are two things that I think that needs to be addressed. Like, I understand that there was like food stamps for the summer program, like maybe people on food stamps are receiving extra dollars for their young people being home for the summer, but I'm going to say that we're probably going to get a lot of that again.
Great. Any other reflections people want to share?
I would just, sorry, I didn't mean to. Corinne was polite and raised her hand.
No, I need to sit back. You step forward, Amelia.
Okay. I was just going to say, we weren't, the grantee last period, but we were, I was involved and participated, and I was surprised at how fast those funds get used, right? Like that there is so much need in our community that, it was like, hey, we're gonna have these funds, and then whoosh, they're gone, and we were pretty selective with, like the category of what we were going to provide support for. And just really surprised at, you look at those numbers, right? You think $200,000, like that's a huge impact. And it really is. But the need in some of our communities is so high that like that barely does a dent. And I do think that these things are so important. And, like we're talking about things like transportation, being able to connect folks to the system of care. Those are such huge barriers. And like, even simple things that families needed to be able to, access services or, increase their chances of positive health outcomes. It's incredible the amount of need that's there. And I don't know that, we alone are going to be able to fix that problem, with just agile funds. But it's, also exciting to learn about the social health benefits. But I also want to acknowledge that I think something that we see a lot too that, got mentioned earlier is that kind of, cliff that happens when you are just outside of that benefits range. And, I've, worked with families over the year where the parent like literally quit working because they couldn't afford to lose their benefits because, continuing to work, they wouldn't have the same level of benefits and care that they had, at the end of that cliff. And, we've just really seen a lot of families in our services where that has been a huge barrier in terms of access to legal support around custody to keep kids safe. And, there was a Victim of Crime Act pool of money that came that was like this experimental thing that they did one time. So one grant period, we had funding to help people access an attorney. And those funds went super fast too, but that was such a huge impact for those individual families that were able to access those funds in terms of being able to keep those kids in safe home placements. It's like, sometimes there was the threat that if the other parent got custody, those kids were going to get removed. So those funds helped prevent removal and allowed that safe parent to get kids access to the supports and services that they need. But it's like, they're just over the income limits for the legal assistance, and then not enough to be able to hire an attorney and fight it on their own. And, that cliff is just there in so many aspects of the work that all of us do. And I don't know, how we address that, but I really wanted to call that out after it was mentioned that is such a huge thing that we see when we're serving clients.
Yeah. So I think what I'm hearing in all of this is like there's tremendous need across our communities, right? The benefits that do exist aren't enough, right? There are still gaps. And there are burdens associated with those benefits, which is the beauty of where the system of care agile funds come in, because it's flexible, it can be quick, it can be responsive, right? And system of care dollars are quite small, right? And so, how can we make use of some of those other resources and ensuring that system of care grants really are kind of, having as big of impact as they can. So with that, I'm going to bring back the slide deck and shift us to thinking a little bit about some of these other resources. So leveraging other resources. So this is just a snapshot of some of the other similar funding sources. So I'm assuming that many of you are familiar with these things. We're going to hear a little bit more about them. And in our conversation today, it would be great to hear kind of like, are these funds working? Where are the gaps? How are you bringing them in or considering them within your agile funding decisions? So the first one here is CCO flexible funding. available to CCO members. This is a case-by-case decision, right? It is not a have to spend on this, but CCOs can spend on it. It's really non-Medicaid covered services that support health. So it can go to things like food, housing, shelter, cell phones, air conditioners, okay? Lots of money going out. Again, most of it going to housing. There are reports that you can access on OHA's website that show you exactly how much funding is going to what per CCO. So if you are not familiar with what your CCO is spending on, it would be great to go check that out. There are kind of related to that, there are separate flexible funds for those who are involved in wraparound. Those can be accessed via the CCO. They can also be accessed for fee for service. There's two processes. Wraparound flexible funds. Again, these are, funds to purchase one-time or occasional items or services for youth or families when they can't be provided by another funding source. So there's a little bit of a barrier there potentially. And the needs have to be directly tied to the wraparound plan of care. At least to the CCOs, this is provided through their global budget, kind of a carve out. For fee for service, those are pretty new funds. Wraparound has been provided by OHA directly since November of 2022. It's been really underutilized, though. I asked Christiana for some data about how often those funds are being used, and she told me that numbers are currently too low to report. So it would be interesting to know if you've tried to, or somebody who's tried to access wraparound flex funds through OHA and kind of what happened there. There is a form that is part of the slide deck, so make sure you all have that if you don't have it. Child welfare. So I think some of you probably know about the family preservation pilot that's happening. This is not available in all parts of the state, but this is an attempt to better support families who may be at risk for child welfare involvement without having an active case. And part of that pilot program has some similar flexible funds that can be used as standalone or to help connect families to other supports. Again, I was trying to get some data from child welfare about, kind of how many dollars have been spent, what kinds of services. I didn't yet receive that. But if you know of somebody who's accessed those flexible funds through child welfare, family preservation, great to hear that example. Medicaid health-related social needs. I'll just introduce this and then Steph, maybe I don't know if Steph, you have a slide or you just wanted to share out a little bit about it, but
sure, whatever's helpful.
Okay, well, why don't you go? Give us the spiel on Medicaid health-related social needs because it's really and exciting.
What amount of time do you want?
I don't know, 3 to 5 minutes. I don't know how much people know about this and what the interest might be. So.
Okay. I do.
Okay, I'm sorry. Just pause. I'm going to jump to community and school-based funds, and then I'll just turn it over to you. Okay. So community and school-based funds, these are like other funding sources that are available either, through faith-based organizations, through school. I know my kiddo has some flexible funding that's available at the school that we fundraise for, and families can tap into that. I'm sure that type of support exists across multiple schools and school districts, but we know, and then there's also the community demonstration projects that are happening through ODE. I know some of you are involved in that. So, just to mention that there is lots of other flexible funding out there in community that is generally kind of, solicited via foundations and donations, and all of that is an important asset to mention here as well. Okay, Steph, please.
Okay. So I do have a slide deck, but what I'm going to actually do is maybe I'll send it to you at another time, or we can talk about it in more detail in our breakout sessions. But just as an overview, we have something called an 1115 waiver. It's a way that we can ask the federal government to change some of the structures of Medicaid for either changing benefits or changing the types of services or changing how we pay, things like that. So we had a waiver approved in towards the end of 2022. And part of that waiver is focused on youth with special healthcare needs and expanding that age category up. So just a flag there, because I'm sure that's probably of interest. But they also have health-related social needs. It's very jargony, but it is a way to support additional housing, nutrition, climate mitigation, outreach, and education for members. And so the health-related social needs benefits are it's a smaller eligible population of people in Medicaid, really aiming to help people who are transitioning across either systems, so like discharge from a residential facility or discharge from acute care, aging out of child welfare, aging out of the youth with special healthcare needs, like transitioning from a pediatric to adult care system. Again, I have lots of slides. I'm happy to send it to you with more details so you don't have to take frantic notes, but that's the group we're focusing on. So it's not all OHP members, but I think there would be a lot of overlap in your population as well. And then the services that are included, everything I've been hearing is really promising in terms of where people may be eligible. We've only launched climate so far. That launched in March. And so that provides air conditioners, air filtration devices, mini fridges if you have like a temperature control need for medication, portable heaters, portable power supplies. And so that launched in March. That's going great so far. And we are going to be launching with housing services November 1st. And so again, if they're eligible populations, there's a lot of tenancy sustaining supports, rent that can be provided for up to 6 months, medically necessary home modifications, utilities, back payments on utilities or on rent, storage fees, really promising. And I think what I would focus on is our initial population here are people who are currently housed, but at risk of losing their housing. And so a lot of what you were all just talking about, I feel like I heard a lot of the similarities where, somebody who has a job, their kid gets sick, they need to stay home with their kid, lose the job, can't pay for rent. And that's like exactly where we want to be able to come in and support a parent or a family and not losing that rent. Really these like acute situations where something happens and they may lose access to the ability to pay for rent. And so it's a short-term amount of rent, it's 6 months, but certainly the type of thing that we would be able or we'd want to see support for. And so that's launching November 1st. And then we'll have additional nutrition supports launching January 1st. And those nutrition supports, again, everything I'm hearing is like, yes, I'm glad we can layer this on. There's pantry stocking, there's medically appropriate meals and meal delivery. And it's VeggieRx. I think there's one other thing, but it's all meant to say, like, we know SNAP is inadequate. We know these things aren't really working. And because of how waiver funds work, it's a little bit more flexible as a benefit. We're able to support paying for somebody to stay with a friend, like things that HUD funds would never pay for, but we can support. And it sounds like your Agile funding is kind of like that too. And so hopefully there's something that we can do to be, maybe stacking them to support a family or layering them in different ways and getting creative there. So that's a little bit of a teaser. There's lots and lots of layers and information that I'm happy to share, but that hopefully gave you like a little sense of it. Yeah.
Hi, I'm pretty new to the CCO world, so forgive me if this is not an obvious question. But when HRSN was in development, was there ever a conversation about transportation as a health-related social need?
Yes. And so there are some states that actually did get transportation. It's, everything you're also saying, I'm like, okay, we're writing this down. At the time that we went forward, CMS, our federal partner, said, we think that because of HRS funding and flexible funds at CCOs, you shouldn't need more transportation supports. And we asked for it. They didn't agree. They needed us to really prove that this was a need. And so this is something that I think we're interested in prepping for potentially expanding in our next waiver. We are also, this is like happening now because we absolutely hear the same need. We are trying to push CMS to let us do, I don't know, they won't let us call it non-emergency medical transportation, NEMT. They won't let us call it that. But if someone needs to get to a housing facility or needs to get to where they can pick up their food, and that's something that's a medical benefit as we're thinking about it from the waiver, they should be able to get transportation covered. And so we're pushing them to try to say, like, can we use funding to do that as well? So in the works, but I can't promise anything. Yes, I see a physical hand. That's so fun.
I can't, yeah, I don't know where my is, but I just want to make sure that something, because the thing that you said about how they are like, well, you have health related service funds, so like that's covered. The problem is like when we access NEMT currently, which I know is different, but I just hope that this is, because you said like these are things that you're trying to document so that you can advocate for these things in the future. The thing that always comes up, and I'm sure you've already heard this, but I just want to say it in every single space that I'm in, just so like it's like consistently documented, is that when we're working with families, they can only bring the child that they are seeing the appointment for. So if they have more than one child, they can't access NEMT. And so that becomes a barrier. And that's like the big reason why NEMT isn't meeting that need.
I really appreciate that.
Steph?
Yeah.
I'm just gonna step in. Sort of combining or building on, Corinne's comment. One of the things that we have been talking about within a variety of the subcommittees in the system of care space at the state level is that families are a unit, right? And so the way that our structures are built is really just individual focused. And when we're talking about a young person with challenges, like we're not structuring our system to respond to the family and the system that is responding to that crisis within their system, right? So like a youth is suffering, so are their siblings, so are their parents, right? So the transportation issue is just one sort of fallout of that, of thinking of this individual as disconnected from the rest of their sort of family net. And so if we can kind of try to think differently about youth services and how they affect the whole family when we're negotiating with CMS and other places, I think we can set a different floor that allows for siblings to be able to get into the NEMT if that's the only way for the family to stay together for the day, or there's no available childcare. You know what I mean? Like as we're sort of looking at these things, we think of them in silos as like, this is transportation, but in this case, this is childcare, this is respite, this is access to the grocery store, whatever. I know families in rural Oregon will combine their whole trip to do everything they need to do in town, right? And if they can't get transportation to do that, then they have to choose between like the prescription or the food, right? And that's an impossible decision to kind of force people to make by the way we structure our systems.
Yeah.
So I'm not sure how you can do that, but like as we all sort of continue to talk about children's services, really using it like a family unit as a floor instead of the individual child just makes so much sense.
I really love how you describe that. And totally in the same mindset too. One of the things we're trying to do with the waiver that we haven't really done successfully to date, and now we're getting, we have more people who are analysts, research analysts, is to try to understand some of the services and access as a family unit, and like to think through who's getting services. And it makes sense in some ways because now we're starting to see like, okay, if they need air conditioners, what does this really look like? Do they need them for all the rooms? Are they getting them for all the rooms? Like things like that we're trying to think of households and family units differently.
And substance use disorder care too, right? Like I saw, I think in the Governor's Foster Care Advisory Commission's report that they were recommending residential facilities for families when one person needs substance use care, so that they don't have to separate, so the whole family can change their style of interacting, right? So that there's actually a reintroduction that's functional. And so I think there's like movement in this all across the system of care, but I think we probably need to try to get more consistent about how we're talking about it.
Totally.
Okay. This is awesome. Want to hear from more of you. So we're gonna shift into some breakout rooms. And you get a choice. I've got 3 breakout rooms that are ready for you, kind of depending on what your interest is today. So group 1, breakout room 1 is around processes and procedures. So this is really specific to like those of you who are administering agile funding, right? If you want to talk about kind of operationally how you're doing that, how you're distributing funds, who and how are you distributing, making decisions about those dollars, how are you applying an equity lens in those decisions, how are youth and family involved? If that's what you want to dig into with your colleagues, that's your room. The second room is kind of just generally other funds. So what other resources are you leveraging? Things like the CCO flex funds, the wraparound flex funds, child welfare, family prevention, other community and school-based supports. If you want to talk about that and kind of how that's working or not working, that's the group for you. And then if you want to learn more about the health-related social needs and learn more about how those are actually getting distributed in communities and how you can tap into those, then you can go to the third room, which is with staff. Hopefully you can facilitate that one. Okay, does this sound good to folks? I'll give you a thought, give a minute to kind of figure out what room you want to go to. Let's plan to be in those rooms for, I don't know, 15, 20 minutes. Does that sound good? Okay. We'll see you in there. You should have an invite to the room popping up somewhere in your Zoom world.
Hey, Christy. Do you need any support?
I'm just here to close the rooms.
Perfect.
Thank you, though.
Were you in that room with Selby?
Yeah.
Okay, I tried to forward over her phone connection because I think her video transferred over, but there was no way to move the call-in audio.
Yeah, she was able to get her audio and on, so that was good.
Perfect. I guess since I have a second or two with you, are you attending the CCO Oregon Annual Conference?
In October?
Yeah, are you driving?
Yeah, yeah, because I'm participating on that panel with Lucy.
Okay, awesome.
Yeah, yeah. I went years ago. It's a good one. All right. Welcome back, friends. Nice to see you. We've got just about 15, 20 minutes left. Would love to hear kind of report out of what happened. We only had 2 rooms in the end. Amanda, I think you were in the room with Steph for a minute. So if you have anything to share from your conversation about the health-related social needs, that would be great. And then I'd love to hear what happened in the policy and procedure room as well. Amanda, do you have anything to share from your convo with Steph?
It was just a quick, I mean, I was just curious how other folks were adapting their procedures around health-related social needs and how to integrate that into system of care. Because I had just done the obvious stuff, right? Like invite my staff who do health HRSN funding to come to my committee meetings and present about it and talk about the benefit and how our families and advocates can help folks access that funding and that benefit. But I was just, that was like an in the box solution, and I was curious what out of the box things people were doing. So, and we talked about, you know, how it'll be interesting to see this benefit adapt over time as things roll out.
Yeah, I am very curious. So maybe we can, if it's of interest, we could look to bring that back as like a sole topic, either at a grantee collaborative or maybe just at the regular learning collaborative, particularly as a role at the housing benefit. Curious to see how that goes.
Yeah, I can jump in and kind of echo what Amanda said, in that we also try to let folks know within our system of care network about these other funding sources, but it's hard to stay on top of it and to know what's available and to be communicating that, you know, with the entire network without doing a formal presentation at each meeting. And then if we have new members come in, they're not aware of it. So it's, you know, and I can't ask the managers of these programs within the CCO to attend all the meetings because they have so many other meetings. So that's a constant struggle for us, is communicating that information, and also just awareness for myself. I don't know about all the funds half the time.
Yeah, I know the system of care, the grants committee is going to be talking about this topic at their July meeting. So just in a week and a half here. And I think particularly given that these new HRSN benefits are entitlement, right? If you qualify based on these things and you need the housing service, you will receive the housing service, right? So I'm curious what that means for the system of care agile funds, right? I mean, I would not be surprised if the grants committee wants to provide a little bit more direction about, you know, if eligible for HRSN, you know, you really should be using those funds first.
Right. And we're at the OICCO, we already implement that. It was interesting, this overlapped with some of the other rooms I jumped in, but the way we designed our agile funding in the last cycle and the way we're going to approach it this cycle is we want to exhaust the other options before we dip into agile funding. So even if folks qualify for flex, you know, we might use that, but the funding might run out, might not cover everything, but we just want to use agile funding as kind of the last resort. So it's reserved for folks who maybe don't have YCCO. We want to reach those people too, or be able to supplement the limitations of these other benefits and covered resources. And we're just really lucky here that our early learning hub is integrated into the CCO. And so the service integration team manager is a YCCO staff member. And so we have a lot of communication about flex funding and the implementation of all of those things, because we're just lucky that we're all together.
Corinne's got a burning question.
How did you raise my hand? That is so nuts. That is so funny. Now, just to know that can happen, like someone can raise your hand for you and be like, I need you to ask. I was gonna ask, like, how are folks able to monitor that? Like, monitor that they did access health-related service funds or other spaces before agile funding?
For us, we're lucky to be able to use our SITs, our service integration teams, because they already kind of had that set up for us. So that was our solution, but I think that's probably like a small community solution.
Yeah.
I'm not sure
Do you
that's
know
a big
how they're
community.
doing it though?
Well, so because our service integration team manager is a CCO employee, they can see our HRSN referrals because they have access
So they
to our
just look
system.
there.
Yeah,
Okay.
exactly. But I don't know that solution will work for everyone because we're lucky that person is, you know.
Yeah.
already able to access that information easily through the CCO
Yeah.
because they're a
And then
staff
I
member.
see Selby's point here, which is like you're going through the case managers and care coordinators. And I feel like for us, when we did agile funding, we had families request directly to the agile funding pocket too. So it was with this like the idea that they were not having to go through like care coordination or case managers. So interesting.
Well, that's partly because we are running our Agile funding program through an additional set of cross-sector committees in each county. We're not running it through like a CBO or the CCO. It's through these cross-sector committees. And so, and that thought was actually to make it less burdensome on families. The thought was that the families don't have to track down and do the application, that the care coordinator can do that for them. But I can also see how it's nice if families get direct access, but that's our model's not set up that way.
Yeah, and that's something that as we're trying to replicate what Selby has going on within Washington County, within our region. And that is something that we're definitely coming against is can we let parents self-refer? Can we let community partners, or does it have to be a committee member who's the referring agent? So anyway, it just gets very complicated. But I also wanted to say something about the SIT. So the service integration team model, that's for rural communities. I believe that they have a dedicated staff member, so they can do all of that tracking, and they have this enormous knowledge of services and funding sources and connections that I don't see our preventive staffing group or our wraparound committee or I'm sorry, our press level work group is going to have at their disposal, because we're not going to have dedicated staff.
One of the things that Jennifer talked about in our policy and process procedure room, whatever, all of those P's, was the way that they've used Agile funds to kind of bring together like their practice level work group, their wraparound review team, their child welfare prevention team, right? And one of the Jennifer, you asked me not to write notes, but I did write down one of the things that you said, which was Agile funds are building buy-in from different systems to the system of care. We ask them for so much. It's nice to be able to give them a resource in return. I just think that's like really awesome leveraging of this tiny pot of money to really build partnership. And also the 90-minute meeting that all of those folks are in, where they can do case level staffing, wraparound review, community level staffing, right? It's more efficient, and I think potentially more effective as well. So super cool work that Jennifer's doing.
All right. Anything else people want to put out into the Zoom room today? Selby, I put a little and Selby and Corinne, and then I've just got a few kind of grant related announcements. And I did put a little closing question in the chat for you today. So especially those of you who have been maybe a little bit more quiet, it would be great to hear your thoughts as well. What are you going to do with this information? Yes, Selby.
I just thought I wanted to give a few sentences about our local efforts to access the family preservation funding. So that's through the ODHS child welfare. And I found out not every county that family preservation funding is still considered in a pilot phase or a demonstration phase, which was surprising to me. And so in my tri-county region, only 2 of my 3 counties have it. Clackamas County does not. And they have to kind of coordinate the request or how they want to use that funding through like the central ODHS, like state level office. They have to get approval for it for how they can use it locally. And Multnomah County's requested free $100,000 is my understanding, so that they can put $150,000 towards a staff person to actually support the work and the agile funding program that's being developed there, and then 150,000 to actually go into the funds to be distributed for families. Washington County already has a child welfare preventative staffing committee set up, and they've requested $600,000. I'm not quite sure yet how they're going to be breaking that up amongst the many initiatives they could put that money to, but I think a fair amount of it is going into some preventative staffing group and kind of their agile funding and what they can do with that money. But it really, I did not make that request to my local child welfare partners because I didn't really understand that that would be an option. It was Multnomah County initiated the idea. But so you could, anyway, check in with your local partners if your county's a demonstration site or not, and if they're willing to, you know, ask for different ways to use that money. So I was just lucky that they initiated it, but it feels great because they're requesting that money specifically to build on top of the agile funding pilot model we had. So it definitely feels like it's building on the learning and the existing process. Just gonna toss that out there. Let you know.
Thanks, Selby. Corinne, did you? Something?
Yeah, I was just gonna, I mean, it kind of plays into what Selby said, more around the lines of like other system of care partners, because I know we talk a lot about braided funding in system of care, and especially when Amelia talked about the matching funds, that's always awesome, but it usually only comes out of a CBO, whereas like it's really hard to get matching funds from like a state system because of how complicated their, you know, like contracting piece can be. Like, I guess what I'm thinking is like, is there more opportunity to have state level, like I'm thinking about like DHS. Like one time DHS was like, we could do matching funds, but then it was like, oh, it's going to take like a year for us to like be able to get that, not literally a year, but a long time to get that kind of okayed through like all of the hoops that they got to get it okayed for. So I'm just thinking like if there's more conversations around matching funds or things like that at the state level, I feel like then at the local level, we could do a little bit more braided funding with some of those state level partners.
Great, thanks, Corinne. Yeah, that came up a little bit, I think in our breakout room, right? It's like because we did ask you to report all of the match on your grant application. So going back to your applications and kind of pulling out, you know, what it is. I think we asked for the source, and thinking a little bit more about how we use that to inform future braided funding opportunities.
Like, where did the original funding come from? Like to do this?
The system of care grants?
Yeah.
It's all state general fund.
Okay. And is that like just from like what is that?
That's from the legislature.
Okay.
So the state
That's your tax dollars, Corinne.
It's just like tax. Okay. So
Yeah.
like, yeah, I guess it's like I wish that there was a way that we could really model like this is braided funding happening at the state level so that people could then see like, oh, okay, it's possible. Let's do it at the local level.
Yeah. And there probably are examples of it, right? But I think the trick is it's really utilizing flexible funds, right? Because what happens is so often those federal dollars, a lot of the state dollars are just so restricted
Yeah.
that it makes it really difficult because then people get worried, oh, I've got to make sure that it's only going to those things and we're meeting these particular outcomes, and I got to be able to report out on how that money was spent, and that's where people get nervous, right? But if you just start with the money that's like super flexible, you know, and you have kind of more creativity, that's where you can start it, in my opinion.
We
Okay.
have a policy option package that we are winding through the insanely challenging bureaucratic process for braided funds at the state level, that if it makes it through all of the layers of bureaucracy would be before the legislature in 2025.
Okay, we are running short on time. I will share these slides with you all, but just want to call out some of the resources that are at the end of this slide deck. So there's a link here to the OHA page around health related services, and they put out annual reports on the flexible fund. So, and it's very CCO specific. So if you want to see like what those funds are going to, how much did my CCO spend, like that information is all available to you here. Link to the Medicaid health related social needs page, so that it would kind of give you more information about the things that Steph was talking about. It sounds like a lot of you are already kind of learning about and thinking about those funds, which is great. This is a great web page. They have like webinars they're putting on for community partners to learn more about those benefits and how to access them. So definitely encourage you to explore that if you haven't yet. OHA wraparound funds, most of those funds are available through your CCO. So if you don't know about those funds or how to get access to them, go find out. There is a link here to the form for people who are on fee for service that, like I said, that is like, I think there were like 3 requests total that have come in since those funds were available. So definitely something to share with your community partners. Make sure we're using those funds as needed. Here's a new crosswalk that OHA put out about the difference between health related services, share funding, and in lieu of services. We didn't even talk about sharing in lieu of services today, but those are also important streams to be looking at. Family preservation, we talked about, and of course, 211 and the one system for, you know, kind of more community-based benefits. I'm sure you all know those things. Couple of reminders about your grants. You've all submitted, I think, for your first invoice. Jennifer, I don't know if you ever got paid, actually, now that I think about it. So let's.
I know there's invoices, yeah, in process from United Way to IHN, but I mean, we haven't, the funds have not been distributed, so you're going to have a very light report from me.
Yeah, okay. So second invoice for your second distribution, you can really send that in at any time. Happy to get you money. Quarterly reports are due July 30th. Please make sure you're using the new reporting template. There's been a few changes. I sent that out to you all earlier this month with a reminder. And our next Grantee Learning Collaborative is on October 18th. Don't have any topics in mind. So if you've got something you want to bring to the group, please let us know. And with that, I hope you all have a really fabulous weekend. I'm so grateful for all of you and the work you do and our partnership. And yeah, always open for your feedback and your thoughts. So, you know me, Grants Committee is also a great place to raise any concerns or ideas you have about these funds. They meet last Monday of the month, 11 to noon. You're always welcome. Okay, have a good one, everybody.
Bye.
We'll see you later.
Bye.
Bye.